Good afternoon, everybody, and welcome to today's community chat hosted by United to End Homelessness here at Orange County United Way. And I'm Becks Heyhoe-Khalil. I have the privilege of leading United to End Homelessness, and I'm excited to welcome you to our conversation today. So we're going to be talking about veterans homelessness and an event that's just been happening this month in August of 2025. To set the context, the VA has been partnering with local veterans agencies like Volunteers for America for a month-long effort known as the Surge. So we're going to get into what that is, what's been going on here in our community a little bit later. It's been this incredible push to help house and shelter veterans in an expedited way here in our community. This conversation is a part of the series that we do every month exploring homelessness, how it affects different parts of the community here in Orange County. And veterans have served our community, our country with honor. And unfortunately, too many face significant challenges from housing instability to navigating complex systems for care. Something that you may not know is that my spouse is actually a veteran and has served this country for about 30 years. And so I have a personal interest in this discussion. We're going to talk about why veterans are uniquely impacted, some of the barriers that they encounter, and how we as a community can respond with compassion and action. So I'm really grateful to be joined today by Jennifer Swan, LCSU, not LCSU, LCSW, there we go, Social Work Supervisor at the VA Healthcare System, and Melanie J. Martins, also an LCSW, got it that time, VA Coordinated Entry Specialist and Outreach Supervisor. These are two rock stars in our community, so I'm excited for you to meet them today. So thank you so much for being here and for being a part of this important conversation. So Jennifer and Melanie, thank you for being here. And I would love to just start with you introducing yourself and sharing a little bit about your work and why this conversation matters to you. And Jennifer, I'll come to you first.
Hello, thank you so much, Becks. So my name is Jennifer. I work at the Long Beach VA as the section supervisor for the HUD-VASH program. And our HUD-VASH program services the city of Long Beach and all of Orange County. The HUD-VASH program, because it can be a little confusing to some people, is a partnership between the housing authorities within our communities and the VA. To provide permanent housing to veterans with a housing authority voucher. So you can kind of think of it like a Section 8 voucher. And then the VA provides the ongoing case management. This conversation matters to me because I think it's important to spread awareness on how our community is coming together to bring awareness to what areas we might still need help in. Unfortunately, ending homeless cannot be done alone. So it really is a team effort. And so that's why it's so important to me.
So much, Jennifer. Melanie, how about you?
Hi, good afternoon, everyone. My name is Melanie. I am the Homeless Outreach Supervisor and the Coordinated Entry Specialist for our VA Long Beach. So what's that mean? So part of my job is I supervise the homeless outreach team that we're actually the ones that are out on the street, going to encampments, going to shelters, going to anywhere where they may be an unhoused, unsheltered veteran with the goal of linking, referring, providing case management until that we can get them connected to programs like HUD-VASH, our grant and per diem, which is our transitional housing, our medical care, and a number of other community programs. And just like Jennifer said, the community piece is so critical, which is actually the second part of my job as a coordinated entry specialist. It's really my role to make sure that our services are integrated with the community, that we're not working in this silo, because like Jennifer said, you can't just be the VA that's working to address veteran homelessness. It takes a lot of different programs, a lot of different people, a lot of different support. And I think for me, this work means a lot and it matters because I've been in the veteran homeless services world for the last 10, 11 years in different capacities through nonprofits with the county and now actually directly through the VA. And homelessness in general is something that is very important to me just personally, and addressing it and ensuring that people have the human right of housing And veterans specifically is such an impacted population. Even though we have a lot of resources, they're actually disproportionately impacted by homelessness. And they've served our country, so we owe it to them to reach out and make sure we're getting them connected to everything that they're entitled to. So this is really important that one of our most impacted and vulnerable populations are served in our community.
Thank you so much. And, just what both of you were saying about the nature of collaboration, the nature of each agency, bringing their unique piece to the puzzle. That's absolutely, what we believe in here at United to End Homelessness. And so excited to dig into this conversation more with both of you. And thank you for just starting us off so well by highlighting that need for collaboration in order to truly have impact. So, big picture. And Melanie, I'm going to come to you first with this question. So, as we talk about veterans transitioning into civilian life, that might be what are kind of some of the unique struggles? And I know from my own husband retired from 30 years of service. And so moving from 30 years of service and that being what you know to civilian life can be quite an adjustment for somebody. And so I would love to just hear a little bit more about some of the unique pieces that veterans are facing and perhaps some of those challenges that could contribute towards housing instability. So I think for those of us in the civilian world who aren't super familiar with what that looks like, there's a lot that we don't know about. And so Melanie would love to hear what you can add to that for us.
Yes, absolutely. And I know Jennifer's also going to touch on some barriers as well. So I'm going to give kind of a general overview. We have both systemic barriers in our community, right? Those systemic barriers are things like our systems. Even though like we have a lot of really great resources, increased resources for homelessness for our veterans, there are still a lot of barriers that kind of get in the way. Things like shelter availability, program availability, staff capacity, to make sure these programs are working well. And just like sometimes what is can feel a bit like the bureaucratic process to veterans, right? Like documentation gathering can take a lot. If you are now homeless on the street, you don't have your documents, just gathering those documents, if you have nothing, it's going to take you a hot minute to get all your paperwork together. And you need most of that paperwork to get into any program and get permanently housed. So we have those bigger systemic issues like that. And I will say, I can see over the last 10 years that our systems have been working to become less bureaucratic, to reduce those barriers for veterans to get services. They're increasing things like same day access to services, trying to do things like not requiring paperwork right up front. As long as they're working on gathering paperwork, they can at least get into the program and start the process. But things aren't perfect, right? Things are still there. And then I think kind of what to you speak to, we have those individual barriers that our veterans come with, those are going to be the things like our mental health challenges or substance abuse challenges, just adjustment to this civilian life may not feel quite right. And honestly, it kind of depends too where veterans started. So are they coming back to a support system? Did they have a support system to begin with? Was there trauma that they experienced before they even went into the military? Did they experience trauma there? So, it's all really intertwined. And I think we just have to realize that both things exist at the same time. So our systems have to be changing, which they are, but we're always going to have those individual barriers for veterans that's unique to the person. And I think that's really why it's important to us to make sure that we're treating each veteran as an individual and not making assumptions about their mental health, their substance abuse, just because they're homeless on the street, because a lot of times there are those assumptions. And yes, that mental health and substance abuse is a barrier for many veterans. That is not the only reason that some of our veterans are on the street. Income, the cost of rent is a big deal. Domestic violence, we have a lot of students, including our veteran students, that are on the street because they're going to school and housing's just too expensive. So I think also breaking that stigma of like what that picture looks like.
Thanks so much for helping to kind of challenge perhaps some preconceived notions and ideas that some may have had kind of coming into this conversation, and for that reminder that anytime we're talking about something as complex as addressing veterans homelessness, we're talking about people, and everybody has their own unique story. And then we're talking about systems that are complicated, and most systems weren't actually built to be people friendly. So it's always good to hold those two things in tension. Jennifer, is there anything that you'd like to add in here around veterans homelessness? And then do either of you have some of like the latest numbers about kind of what we're talking about when it comes to veterans homelessness here in Orange County?
Honestly, Melanie did an excellent job. I think she hit the nail on the head with all that. So I actually don't think I have anything to add.
Sorry, I didn't mean to steal your thunder, Jennifer.
No, you're fine.
I do have some numbers, so I can share really quick because I know data isn't always the most exciting thing for people, but I think it's important to understand the numbers and how they kind of interact with each other. So the first set of numbers I'm going to share actually comes from our point in time count, and I think most of us are familiar with it. But if you're not, it's an annual count, well, every other year for Orange County that's done of our people experiencing homelessness, and it's actually required by HUD, so we can get a general idea of what our homelessness landscape looks like. So the last point in time count that was done was in 2024, last year. And it shows the total number of veterans that we have is now, let me preface this too. This is a day, a picture, a snapshot of what veteran homelessness looks like. So this is why sometimes the numbers might look different from other reports because it is one day. It also doesn't verify veteran status, things like that, where it's all self-report. But back in January 2024, Orange County was reported to have 328 veterans experiencing homelessness. 248 of those veterans were unsheltered, and 80 were sheltered. So that was our number from last year. Now, a much more, I think, updated number comes from what we call our veteran by name list or a veteran registry, which is a list of veterans experiencing homelessness in Orange County. And these are all veterans that are engaged with community providers, have that be the VA, county outreach, supportive services for veteran families. So it's both veteran and non-veteran providers. So it is a pretty comprehensive list. Are there sometimes veterans we find that aren't on that list? Yeah, sometimes, but for the most part, it's pretty comprehensive. And as of Friday, our BNL listed 229 veterans experiencing homelessness. Can kind of pull unsheltered and sheltered, but because the list is also kind of a living document where it's constantly changing, it's not always the most accurate either because it evolves. I could give you a number from Friday, it's going to look very different today because things have changed. People have gotten housed, people have gotten in a shelter. But I can say that about 96 of those 229 are what we call chronically homeless, which means they have been on the street 12 plus months or have had several episodes of homelessness in the last 4 years that equal 12 months. So, and they have a disabling condition. So these are kind of what you think of as our most vulnerable, most at need on the street. And then I'll do you want me to jump into the search now, Becks, or because I have some data there too.
Yeah, well, I think while you're just talking about this, kind of our most vulnerable on the street, I think this is a great pivot to jump in to explain the surge, what the purpose was, what happened. And I know that time is ticking away for us, but I know that people are really curious. What were you guys up to? What happened? What was the goal?
Yeah, and I will talk through this really quickly because I know Jennifer has some really important points that she needs to address. She needs to talk about them. So real quick, the Surge was an event that we are currently still actually participating in. It's basically enhanced outreach efforts through the month. It started in June, the planning, the real work started in July, and now in August when we're holding our Surge events. We've had 3. August 7th, August 14th, and our final will be this Thursday. And basically, even though we already are really collaborative with our community partners when we're out in the street, this was even more so. We had a main hub, and we're doing all this work on the hub while the teams are out so we can get them into a bed that same day. We can offer them a veteran transitional, a shelter bed. We can offer them a screening for HUD-VASH, a screening for SSVF. We're actually on this Thursday, we're also going to have the Veterans Benefits Administration there to help with claims. We're going to have legal services. So a lot of things that impact their ability to be housed, that get in the way, that create those systemic barriers. We're hoping to have there addressed, so we could just get veterans indoors that day, with also working on same day housing plans, which means we're either getting them into HUD-VASH, getting them to SSVF. And Jennifer and her team have done a lot of back end work with these veterans because they're all pre-identified from that BNL, to make sure that these veterans are expedited into housing, into the referral process, into the program. So we've just been out on the street getting these veterans indoors, and our numbers are looking pretty good. We had 91 originally identified for these surge events, and so far we've gotten 35 of them indoors with 18 permanently housed. And we have several more pending shelter placement, GPD placement, and are real close to getting permanent housing. So our numbers just keep moving forward. So it's been a really exciting event. A lot of work. We've done a lot of back end work with our partners, a lot of case conferencing, a lot of planning, but it's really resulted in some really great results for our veterans.
I just want to highlight and underscore. So this was a concerted community effort, really bringing the local providers together in partnership with the VA. 91 veterans who are currently unsheltered, so sleeping outside in Orange County, had been identified. The purpose of these events was to go out, connect with these veterans, and try to do anything that could be done to help get those veterans indoors. And so far, 35%, which, quick math, over a third.
Yeah, actually 35 of them. Yeah, over a third. Yeah, exactly.
Yeah, are already indoors, and 18 of them have been permanently housed. So I want to call that out as a huge success, and thank you both for your leadership here. This is pretty remarkable, and I know that we are not finished and that there is still a flurry of activities happening with the surge. And so, Jennifer, is there anything you wanted to add about the surge activities?
Yes, there is like you both have said, there is a lot going on, especially in the back end. For instance, speaking about this being a community effort, the housing authorities are also making some efforts on their side as well to do pre-inspections for units so that we can move veterans in quicker. And it really just is an all community team effort, whether it be the housing authorities, the VA, U-Ball at United Way. Don't forget to give you guys your kudos as well. SSVF agencies, nonprofits that are for all homeless as well as veteran homeless. It really, truly is an Orange County effort. It's very impressive to see.
Thank you for the shout out to the OC community. Good to hear that everybody's been rallying to support our veterans here. So as we're talking about solutions for veteran homelessness, I'm curious from your vantage point, is there anything kind of unique or, right, we all want to think that Orange County is special. We all want Orange County to be the best. But I'm curious, Jennifer and Melanie, from what you've seen, what programs, what initiatives, what solutions, interventions are you seeing here in Orange County that are really having a significant impact?
Yeah, so I think one of the biggest impacts I've seen, especially over the last year, is the implementation of what we call One Team. And One Team really is that focus on the community effort. So, like I said in the beginning, like we can't do this alone, whether that mean just a nonprofit working on homelessness, trying to do it alone, or the VA trying to do it alone, or whoever else, right? It really takes a team. And so the One Team effort is really focused on all the community providers coming together and figuring out, okay, what can we all do together as a team, as one team, to help get these veterans off the street, right? And some really great best practices have come out of that. We have really great communication with one another. It doesn't matter if you're at the VA, it doesn't matter if you're at a housing authority, it doesn't matter if you're with an SSVF agency. If you are finding a homeless veteran, bring them to the table, right? Let's all communicate on how we can service the veteran for what they need. And that has really, over the last year, I've seen been the biggest effort and is causing the most change.
Thank you for that, Jennifer. And I think there are some OC1 team members that have tuned in for this chat. So I'm just going to give them a little shout out and a little thank you for the work that they're doing. Mel, is there anything that you want to share? Any wins you've seen from the one team process or from the one team collaboration that's been in, or anything else here in Orange County that you think should be highlighted?
I mean, I think it's everything Jennifer pretty much just said. And like, even though this surge event was like an enhanced version of our collaboration, like the collaboration is there. It's, we were actually right before this call trying to collaborate for this veteran with a very difficult situation. And we're pulling in all our partners and everyone's answering our calls, everyone's answering our emails like really quick because we all know each other. We've all spent that time building those relationships. And so those calls get answered quickly, which means our veterans get their resources and their needs met much more quickly. So it's just seconding what Jennifer said about one team. I think it just continues to grow. In the veteran community, I feel like we all kind of know each other. We can call each other. We can just consult. Sometimes it's just like, what do I do? And that's just really great to have that support. So in any one program, we don't feel siloed. We don't feel isolated. We feel like we have a team out there that's helping us.
I know you two live and breathe this, and this has kind of become your norm in Orange County for this level of collaboration. But I know that not that long ago, you were speaking at a conference about one team, because the things that are happening here and the collaboration that's happening in our community is not the norm across the rest of the country. So I am going to put you on the spot a little bit, but could you highlight that and kind of how what's happening here is helping impact things on a national level?
Jennifer, do you want to take it? Do you want me to say?
I think you've got this, because I think mainly, well, I guess I'll start and then hand it over to you. But mainly a lot of those upfront efforts were done with Melanie and her team and her CES and the community, right? So a lot of it started in the outreach side of things. So whether it be outreach VA, outreach SSVF, outreach community partners within Orange County, all of that kind of started with them. And like Melanie said earlier, finding a veteran on the street and communicating about how to service this veteran for what they need. And so Melanie, I'll hand it over to you to talk about that piece.
Yeah, for sure. And I remember being at this conference. I know what you're talking about, Becks, and they're talking about this one team approach. And I remember all of us from like Orange County were like, what are they talking about? Why is this so mind blowing? Like, why are we having a conference? We do this already. Well, apparently, it turns out not everyone does. And what was just basic everyday practices to us wasn't a thing. So because we have already kind of ahead of the game, we were able to bring it to our community, and we took off running with it. And also, we've been asked to speak at several national calls and present at conferences for our VA to talk about what we're doing as outreach, but also collaborating with the one team and collaborating with HUD-BASH and collaborating with our partners. So Orange County is really leading the way in a lot of the work that is being done across the country, because we've been doing it. So
Thanks for letting me peer pressure you into bragging about your work. I think it's important to highlight this, right? Because the things that we're living and breathing, we don't realize other people aren't aware of. And so thank you for sharing about that. Everything connected to one team, connected to the third, it's all being about collaboration and people playing their unique part. And so I want to transition now, and Jennifer, I'm going to come to you to ask you about what role can everyday community members play when it comes to addressing veterans' homelessness. How can they help offer support, provide some actions? I know there's a really cool program that the VA has, and so I would love for you to share more about what people who are tuned in today, how they might be able to help.
Oh, thank you. Yes. So the biggest thing is talk. Talk to everyone, family, friends, people at networking events, anyone that is willing to listen and has units for rent in Orange County. Talk to them about housing, even just one veteran in their units. We do have housing specialists that will be happy to talk to them more about like how HUD-VASH works and things of that nature. But housing stock is always something we're looking to increase. Also for homeless veterans, or really just veterans in general, the VA does have what they call a SAVE program. And so we know homeless individuals are at higher risk for suicide. So the VA offers what they call SAVE trainings. And you guys are going to stretch my mind a little bit on what SAVE stands for, but I'm going to try. I believe it's signs of suicidal thinking, ask the most important questions, validate the experience, and encourage treatment. So that's what SAVE stands for. That's signs, ask, validate, and encourage. And this training is really designed for a broad and general audience. You don't have to be a therapist. You don't have to be a social worker. You don't have to specialize in mental health. And it really helps for just the general population to understand the signs of someone in a crisis and learn what to do when you do see those signs. If that's something you or someone in your community is interested in, you can contact us at the Long Beach VA and we can come to your next church group, community organization, first responders meeting, or even I am a big reader. So if there's a book club that's interested, I'm happy to come talk to them about SAVE training. But yeah, if anyone is interested, just please feel free to reach out and we're happy to give that training.
Thank you so much for that. Such a great way to get some training, to feel equipped to be able to offer support to any veterans who might be in need. And so we'll make sure in the follow-up emails, we send an email to everybody that registered, everybody that watched, and so we'll provide in that email the right contact information if you're interested in bringing that training to your book club, to your coffee shop, whatever that might be. So thank you, Jennifer, for being willing to help expand the number of people in our community who are equipped in that way. To close our conversation, this is the question that I love to ask to people who join me on these chats. A simple question, and I would just love to hear kind of top of mind, what pops up for you when I ask the question, what does home mean to you? And how does that shape the way that you think about serving veterans experiencing homelessness? And Melanie, I'm going to come to you first.
I knew you were going to pick me first. I mean, I think for me, home, it isn't just a place, right? It's a feeling, it's a connection, it's a quality of life. And so I think about that when we are helping to house our veterans. It's not just about, well, here's an apartment, great, see you later, enjoy. It's more than that. It's making sure that they are connected to their community, that they have a meaningful role in their life that matters, because all those things help keep people housed. And so when we talk about homes for veterans, it's so much more than an actual like apartment. It's all those connections, and it's really just improving their quality of life, regardless of what that looks like or what they feel their quality of life should be. It's improving it for them and making sure that they have a life.
Thanks, Mel. Jennifer, how about you?
I don't think you could say it better than that. Great job, Melanie. But yes, I agree with all that. And, you know, in order to start building that community and building some of your supports, right, that really comes with home as well. And so home really filters into everything. If you think about Maslow's hierarchy of needs, one of those is shelter. So I think it all feeds in together. And again, I couldn't say it better than Melanie did.
Well, thank you so much. And thank you for those beautiful pictures of what a home is that you painted for us. I really appreciate you both sharing your expertise as well as something of your heart and the why behind the work that you do. I want to say thank you to everybody who joined us today. We had a great turnout for this community chat. This chat will go up on our YouTube channel. And so if anybody that you know missed this, it would be great to invite them to watch. It will go up onto the United and Homelessness YouTube channel. So we will send an email with all of the resources that were referenced during today's session, as well as some opportunities to learn more. As I wrap us up, a little poll is going to pop up on the screen. So we would love your input on this. It'll only take you a couple of seconds to answer the poll, but it's always really helpful information for us as we continue to do our community chat series. So thank you again to everybody. And together we can honor our veterans, not only with words, but with action, working towards an Orange County where every veteran has a safe and affordable place to call home and the opportunity to thrive. See you next time.